ear pick and I'm trying to go over the top, which I managed to do. So in my head I've done the hard job. I thought, yes, I've managed to get the instrument over and beyond, but just like the ear hook, it just cut through. So the only instrument that's going to remove this is the correct. And also the microsurgery, I said it wasn't effective. It did help a little bit, especially when I was cutting and dicing the wax using the hook and the pick. You can see all those hairs matted, which does make it more difficult to get a suction grip. But when I was positioning the suction tip on the surface of the wax, you can just feel that, is this really going to come away with the suction? And the reason why I'm persevering is because now we're entering the inner 2/3 of the ear canal, at least on the right hand side anteriorly. And the flesh you're seeing there is just actually bone with the thinnest, wafer thin layer of skin lining it. So the skin that is lining that bone is around 0.1 millimeters in thickness. And if we make contact with that bony part of the ear canal, it's like you bump your shin onto the edge of a door or a chair. It's that sharp, acute pain. And I've experienced that before. Hence why when I'm performing procedures that deep, or whenever I'm performing a procedure, I'm just always trying to be